Well, thank you for choosing to listen to the Zelos Podcast. I'm your host, Rocky Snyder, and this is the show that's all about the pros behind the pros in sports, whether they're athletic trainers or team doctors. And in this case, we've got a functional podiatrist in the house, Dr. Emily Splichal. In fact, not only is she a functional podiatrist, owner of a whole bunch of great products to help encourage proper movement, but she and I will be part of an 8-week webinar coming up starting this week. It is a virtual mentorship, begins Wednesday, February 4th, called Fascia, Feet, and Functional Performance. Bill Parisi with Parisi Speed School, Dr. Emily Splichal, and myself. But before we get underway with the conversation and more about that, check out my website, rockysnyder.com. You know we've got the podcast archives. I've got weekly blogs. You can do some training with me, whether if you're in the Central Coast in person, but I also do it virtually and online, and we've got continuing education. But before we go any further, let's listen to these messages from our important sponsor, and then we'll get to the conversation. This episode of the Zelos Podcast is sponsored by Kinetic IQ, where intelligence meets motion. Kinetic IQ brings a biomechanics lab into the palm of your hand, letting you measure movement anytime, anywhere, with just an iPad or an iPhone, and no wearables required. I've been using Kinetic IQ's markerless motion capture in my own practice, and whether you're screening athletes, analyzing posture and gait mechanics, optimizing performance, or guiding return to play, it helps practitioners like us save time, capture more objective data, and make instant actionable decisions. So to learn more about how Kinetic IQ is shaping the future of intelligent movement, visit them at kinetikiq.com. That's KINETIKIQ.com. You know, I can't tell you how thrilled I am to have Metabolic Elite be one of the sponsors of the Zelos Podcast. You know what makes Metabolic Elite different is their commitment to real results. I've seen a lot of supplements and performance enhancement things over the years, but they pair clinical experience with innovation, like Lipitab, their proprietary solid-state liposomal delivery system. It's a chewable format which enhances absorption, like nutrients like BPC 157 and synapses. They're delivered more efficiently in the body, supporting recovery, focus, cognitive health. Their formulas go beyond the basics, solving performance health challenges at the system level. Every product is tested for quality, it's backed by research, and trusted by athletes and clinicians alike. So learn more at metabolicelite.co. And you can get 10% off all of Metabolic Elite products by entering the coupon code ZELOS, Z-E-L-O-S. And before we get underway, be sure to follow us on Instagram at Rocky_Snyder, S-N-Y-D-E-R. Click subscribe, give us some comments, tell a few friends, enjoy the show. Well, Doc, first of all, thanks for being on the Zelos Podcast. It's I want to say it's been some time since we've been together, but that would not be true. We were down in LA at the Fit Expo, and then not too long ago, I think it was in November, you and I were with Bill Parisi on a webinar. So, not that all roads lead to Rome, but it seems like our paths cross. So welcome, first of all.
Thank you. And I'm loving the crossing of the paths. So let's keep crossing paths.
I do too, because I love it. Your perspective is refreshingly different than the path of knowledge that I've been following, and I always love getting my tree shaken to see what fruits fall out or what I haven't discovered yet. So I'm looking forward to this conversation. How about this? For those in the listening audience who may not be familiar with yourself and what you're doing with Naboso, with Barefoot Training Academy, with just everything you've been doing. Give us a little rundown about, give us the elevator speech about who Dr. Emily Splichal is.
Yeah, absolutely. So functional podiatrist, not a traditional podiatrist, functional podiatrist and regenerative. So functional regenerative podiatry is kind of my clinician hat. I'm also a human movement specialist. I started in fitness. So I've been in the fitness industry for over 20 years, from training to group exercise to then training the trainer. Now my evolution in fitness, still education, but more so trying to advocate for the neurosensory approach to human movement and movement longevity. In that category, I've written several books about this: Barefoot Strong, Sensory Sapiens, I just launched in 2025. And then I'm the CEO and founder of Naboso, which is a neurosensory based product line, which is focused around stimulating the feet, hands, nervous system. Probably anything that I speak about has to do with feet, fascia, functional movement, or the brain. So that's my passion.
Well, I love that because I'm intrigued by motor neurology
Mhm.
and just brain science because more and more keeps coming out, and so much so that I can't keep up with it. Of course, I love going from the ground up and from the top down and from the middle outward. I mean, I don't think there's any wrong way of looking at movement, especially the way that you do it. I love it. And I had to do a little homework, by the way, okay, because your last name is rather unique, and so I had to find out the origin. Of course, you probably know that this is a Czech derivative, and the translation is to splash. And I'm like, how appropriate, because you've made quite the splash in functional movement and helping it to inform others and educate them as to the role the foot plays all the way through the chain. But that's a little side note. And that's just a Google search, by the way. It doesn't show that I'm smart or in any way. But here's what I'd like to know is, well, first of all, you, I believe, and sadly saying, are the only podiatrist that I tend to get along with. And
Right.
and I got to tell you, I was at this kind of gathering, like a social event, and I was having a conversation with a podiatrist, and it was local here, and he says, "Oh, this is great." I explained a little bit about what I do, and he explained about what he did, and at the end of the conversation, he's like, "This is great. Tell you what, you send people my way, and I will deal with everything from the knee down, and you do the rest." And I
Mhm.
thought, wow, it just summed up for me the myopic view that I have come to understand. Perhaps I'm wrong, but the traditional podiatrist is really only concerned with the foot and doesn't seem to have a full comprehension of how the mechanics down below affect everything else. But you're different. Here is functional podiatry. What inspired this? Because I know you didn't start out this way. Where did the traditional get dropped off and the functional get grabbed onto?
Yeah, so interestingly, I carried the functional perspective the whole way through. And I think what's important is that my journey started in fitness. Well, it started with me being an athlete. So I was a competitive gymnast for 13 years. And I do think it's important for people who have a history in a sport because you understand movement to a certain component, right? Especially gymnastics for me, it was about how do you generate integrity and control your body weight. And there's a lot that you can learn being a gymnast. So I brought that perspective into the fitness industry. And then I started in fitness and then I went to medical school. And when I was in podiatric medical school, I stayed in fitness. So as I was learning these very kind of closed-minded perspectives or isolated perspectives, me still being in fitness, I started saying like, no, I don't think that's the only way. I don't think that that's the only shoe that we should recommend. I started to create doubt in the profession because again, let me just give a quick example. Let's say you have plantar fasciitis, therefore you need to stretch your calves, right? Because that was at the time what was popular for it. So there was this hand against the wall, one leg behind, therefore, and that's your stretch. And they literally gave that to every single, and I just heard it over and over and over from attending to student. And I was like, there's other ways to stretch your calf. How about foam rolling? How about something else? Right. And then the other example would be someone needs shoes. Well, the one thing that you're going to get is New Balance sneakers. So here's New Balance. Well, the reason why New Balance was recommended is because they were sponsored by New Balance, sponsored the American Podiatric Medical Association. You know what I
Ah,
mean? So it was just like, oh, and that's why we recommend the shoe. So then that's where I started to create kind of the doubt on it. So fast forward through all of my training, I kept questioning things. And then when I was in residency, I actually left residency, I quit. And then I went back to school, got my master's in human movement because I knew there was more to the story, but I wasn't getting it from my professional training. So I got the master's in human movement, and that was the glue that connected fitness, podiatry. The bridge was my master's in human movement. And then from day one, out of residency, newly licensed, I brought this functional perspective. However, I didn't fully formalize it because I had to kind of build my confidence as a young physician.
Sure.
I had to get a network of patients. Like no one knew who I was. I mean, people knew, but didn't really know who I was as a clinician. And it takes like 5 years to build your referral base as a physician to then kind of be able to like define yourself a little bit. And then that's where in 2017, I was like, okay, I'm ready. It's literally 5 years. I said, I am ready to put the scalpel down for the last time and fully push into functional and regenerative podiatry. That's what I did.
Oh, there's so much fear and apprehension along that journey, isn't there? Like, oh my gosh, that good for you for having the bravery to continue through it. So you actually put a pause on podiatric medicine so that with a conscious effort that I need to stop this because I need to go here. Is that really?
Yes, that was exactly what it was because I remember
Wow.
sitting there and so residency for podiatry is surgical based. So it was they create surgeons. That is the way that the profession is shaped, is to create surgeons. You have to do 3 years of surgical training. So anyway, but then outside of that, you're still pushed to do the orthotics, to do supportive shoes, whatever it is. And I remember being a first year resident and I was like, this goes against my ethical beliefs. Like I am like, I don't know if I can do this. Like I'm living a lie. This is not how it is. And that's why I left to just further push into what I felt was authentically the message. Then after I got my master's, I was like, shit, I paid $250,000 for my podiatry training. I have to get licensed. I need to play the game now and essentially get licensed, which means I had to complete my surgical training. And that was another 2 years. And then, yeah.
So, how did you come to terms with that? Because, first of all, kudos for everything you just described. I think that's so amazing and so wonderful. And I'm just left kind of going, oh my gosh. So you had to go back in to
Mhm.
an area that you didn't have true faith and yeah, it's just you didn't have the belief that everybody else was following, and you knew there were other ways. So how did you come to terms with that, and yet still have to go through the surgical practice?
Yeah. I mean, that's such a great question. And I think it takes a certain ability. I don't know where I got this from. I grew up in a very small town in North Dakota, and I was just given this gift of somehow seeing the long game. Like I'm a long game strategy person. I went to school for 13 years. I grew up in North Dakota in a town of 300 and knew that I was going to get out of that state one day. I was like, I'm going to do something fucking amazing one day in this town of 300 with no internet or social media, right? Like this was not right where you're just like, I know there's a big world out there, but so you kind of, I don't know, have these things. So then in that, I saw potential in podiatry. When I was a student, like towards the latter part of my training, I was like, there is so much untapped opportunity here. There is something that you can do with this degree that is not seeing patients from 9 to 5. There is like, I don't know, I was just starting to feel it and see it and connect it. And then when I started getting the master's, my eyes were just like opening up to connecting this. And then I was studying under like pelvic floor specialists, fascial specialists, diaphragm, and like pushing into all these other things that I was like, I am seeing this. I don't know what it's going to become yet, but somehow it's going to all shape into something. So I was able to kind of see the long game. Now it was hard because when I left residency, like trying to formulate things. I mean, my profession was like, you're an embarrassment to the profession. You are ruining this profession. Because I started doing the barefoot stuff. Like I started pushing into the barefoot during the barefoot running boom. And I just got shit on from my profession. And higher up, we were like, I'm going to kind of ruin your career. And I remember emailing one who was trying to block me from getting the residency because I left one to then go back to get my license. And he tried to like blacklist me to get into residency programs. And I remember sending him a letter and I was like, imagine if I was your daughter, right? Like just imagine, because I knew he had daughters. I was like, I am a daughter, I'm a sister, I'm a human. Imagine if I was, and you're blocking my ability to do anything with all these years of school and $250,000 I invested, and you are trying to block that. I'm just trying to like help people. So then he was like, he apologized and then he kind of like, and eventually got into a program. But I was just like, I had to call it out.
Yeah, I honestly, this makes I can relate to a certain degree because in my world of strength conditioning, I base the programs on a unique individual structure, which is a representation of every experience that person has gone through in their lifetime. Right? It's almost like a neurological mirror shining back. And in our industry, we have certain tests and certain guidelines and certain program designs, which I don't feel address what that individual truly needs. So we base it on their unique structure and their unique gait mechanics, because that gives me so much more information as to what movements do they really need to be reminded how to be re-educated on, or what's missing. And I'm looked at by some as maybe just in the same way people were looking at you when you started to describe what it is that you were seeing. So living out in the fringe. It's a nice place, but every now and then they welcome you back into the fold, I guess.
You definitely need a thicker skin, but I think what you could agree on this, but I won't put words in your mouth, is intuitively you knew what you were doing was right and was helping people. So if you are following your intuition, then to me, I feel like you have to lean into it, because I've had a lot of professionals just in the last decade of teaching, and I'm sure you do as well, where people want to kind of exemplify your work, especially younger, right? Like a younger generation is like, oh, when I grow up, I want to do what Rocky's doing or whatever, right? And then they think it's this linear path of just following a formula that was given to you, where really it's about getting information, questioning it. Is there a different way? Is that the only answer? So there's a lot of zigging and zagging and challenging and questioning things that then gets us to connect the dots in the way that we do. And that's what I would encourage the younger generation to do, is to, I mean, that's how industries and humanity grows and evolves, is you have to question and innovate and connect and think in a different way. And for that, you have to have thick skin because you will be challenged, but it's not a lonely thing, but you're leaning into things in a way that's not following the collective group. You are kind of coming out on your own.
Yeah, well said. No, truly, it requires a thick skin and fortitude, and always questioning why. Always, always, always questioning why. So, okay, let's jump into a few things here in regards to the foot, because, well, for one, we're going to be talking about that. I should point that out. This is a good time to kind of do a little plug for us. We are going to be joining Bill Parisi with Parisi Speed School this week, starting Wednesday, February 4th, and running for 8 weeks every Wednesday, basically a little over an hour, almost an hour and a half webinar. and there's still room to sign up, but we're going to be talking about fascia, the foot, and functional performance. So one of the things that people often, I'm sure they ask you a lot about, are orthotics. And I'm just amazed that if we look at the research about orthotics, we'll find that there the soft tissue, there's atrophy. And yet people wear them for a long time. I typically, when people ask me what I think of them, I will say, well, they're kind of like a cast on a broken arm. Eventually you want to, it's helping you get through some healing, but eventually you want to take that away. And when you do take it away, what does that arm look like? You're going to need to redevelop that musculature. So although the orthotics can put a foot in a position that is different than where it was, which might have been problematic for itself or the knee or the hip or the back or wherever, I get a feeling that you and I think similar in regards to orthotics, is that there's a time and place, but it doesn't mean it's forever. What are your thoughts?
Yes. So what I would say on this is maybe twofold on it. First one, yes. So I do agree to certain types of flat feet or overpronation. That's typically where most people are using is their arches are falling, they pronate, they overpronate, they have flat feet, whatever the term that we want to go with. That's why they're initially prescribed custom orthotics. On that, the one that I'm going to say is the exception to this, and then I'll talk about the other one, is when someone has more of like a ligament laxity, where a ligament laxity, there's over 100 ligaments in the foot. There's a very important ligament that is under the inside of the arch, which is called the spring ligament, and it acts like a hammock to the talus and the navicular, which is technically the arch. It's the joint of the arch in the inside of the foot. If that ligament is lengthened or torn, there is no amount of strength that will lift that arch. So this is where you could use a custom orthotic to hold it mechanically because the ligament is not sufficiently intact to hold it. Now, having said that, in all of these situations, I still strengthen the foot. So
There you go.
still have to strengthen the foot. It is not a magic insert. And I tell patients, I'm like, this is not a magic insert. You still need to strengthen your foot. So is it just strengthening of the foot? Is it strengthening the foot and an over-the-counter arch support, so we're less aggressive on it? Or is it a custom orthotic and strengthening the foot? But you can see that strengthening the foot is in all of them. Or is it a custom orthotic for certain activities, like just running, just standing on your feet for 10 hours a day as a nurse? Just an example where you could think of it, right? So it becomes a little bit more personalized, and we're not making these blanket statements. I do not like blanket statements where it's just like, everyone should use an arch support. But even with like barefoot, which is where a lot of people think of me in minimal shoes, everybody should be in minimal shoes. Well, not true. There are some exceptions, right? And it's really the outliers or the gray in between that's where people see me as a clinician. The mass majority of people can do barefoot training, don't need orthotics, and can wear minimal shoes. That's a far majority of people. And then you have the outliers.
We're just going to take a quick pause from this conversation to acknowledge our sponsors, and then we'll be right back. The Zelos Podcast is sponsored by Kinetic IQ, where intelligence meets motion. Kinetic IQ brings a biomechanics lab into the palm of your hand, letting you measure movement anytime, anywhere with just an iPad or iPhone. No wearables required. I've been using Kinetic IQ in my own practice, and whether you're screening athletes, optimizing performance, or guiding return to play, it helps practitioners like us save time, capture more objective data, and make instant actionable decisions. So to learn more about how Kinetic IQ is shaping the future of intelligent movement, visit kinetikiq.com. That's KINETIKIQ.com. At the forefront of metabolic elite is Jim Lavelle, internationally recognized clinical pharmacist, the chief science officer at Lifetime, and the co-chair for the American Academy of Anti-Aging Medicine. He's got over 4 decades of experience and has guided Olympic athletes, professional teams, and leading health institutions. You know what makes Metabolic Elite different is their commitment to real results. Like Lipitab, their proprietary solid-state liposomal delivery system. It's a chewable format which enhances absorption like nutrients like BPC 157 and synapses. They're delivered more efficiently in the body, supporting recovery, focus, cognitive health. Their formulas go beyond the basics, solving performance health challenges at the system level. Every product is tested for quality, it's backed by research, it's trusted by athletes and clinicians alike. And you can get 10% off all of Metabolic Elite products by entering the coupon code ZELOS, ZELOS. Okay, how about this then? In terms of foot strength, there's a fellow in Minnesota, USA Hockey and University of Minnesota, Cal Dietz, really well known in the strength conditioning world, came out with a book about tri-phasic training where he determines what the athletes need in regards to the 3 muscular contractions. Does this person need more concentric? This person needs more eccentric. This person needs more isometric. And I look at the foot in the same way. We've got our short foot exercises, which are concentric. We got our static holds and maybe just like a calf raise and a hold of some sort. And there's our isometric. And then we've got the loading and maybe the utilization of the foot wedges that you and I are very familiar with so that we can get that eccentricity and that loading pattern. Do you have a way, and I'm curious, and I would love to learn this, do you have a way of determining which of the 3 contractions one foot would best benefit from compared to another?
That is a great question. So much of what the foot is doing during dynamic movement is isometric. So it's a
Wait, say that again. Hold the phone. What did you? The dynamic is isometric. The majority is isometric in a dynamic foot?
Yes. When you are looking at repetitive momentous movement, like walking. So this is not me making up stuff. This is not the Emily theory.
Well, you could do that. I wouldn't know. Go ahead.
So I have studied a lot and really respect Ben O'Neill's work and the muscle tuning theory. So to me, that has really changed the way that I look at repetitive movements, because that's really the space that I'm in. I know you are in a different space. I'm dealing with people who are trying to I got walking, I got running, check, but walking for sure, right? Check. And then running is very similar in the sense that it is kind of a repetitive pattern. Now, the intrinsic muscles of the feet fire isometrically. And this is based off of where you look at how they cross joints. So there's really no joint action around an intrinsic. It's not really crossing a joint in the sense of what it would do. It does joint compression is a lot of what it does. And then it does an isometric contraction to increase intracompartmental pressure of the foot. So the goal of the intrinsics is to create a stiff structure. That's what their job is, right? Stability, right? It's trying to stabilize the foot before you move on it. Kind of like the pelvic floor, the transverse abdominals. So this is how I think of the foot intrinsics, is a stiffening mechanism so that when your foot contacts the ground, the impact force energy that is entering it can be potentiated into your fascia more efficiently. If you do not have sufficient stiffness in your foot, this is where you can see a lot of your plantar fasciitis, your Achilles tendonitis, your stress fractures, shin splints, etc., because of an insufficient stiffness in the foot and ankle complex.
And could we say the same thing for being overly stiff? Like there's a Goldilocks spot that you're seeking? Because if it's too stiff and rigid and high, then it'll never get the opportunity to experience length, would it?
Correct. But is the stiffness of the foot from the ligamentous structure and the architecture of the foot, thinking like a true cavus foot,
Uh-huh.
where some cavus feet have to do more with calcaneal inclination and metatarsal declination. It's not tight intrinsics or extrinsics that are pulling it into that cavus. It is actually
More structural and bone shape.
yes, yes. And
Got
I
it.
really hope that this is making sense to the listeners. So it's more of
Yeah,
an
it makes sense to me. So keep going. Forget them.
is an osseous structure, almost like there's a foot type, and this is like not a clinical term, but it is a pancake foot. And a pancake foot does not have the rotational overpronation, midfoot dropping, and this adduction towards the midline of the midfoot. You don't see that. You don't see internal rotation of the tibia like a overpronated flexible flat foot. It is literally a pancake. So then you look at it on X-ray, and the metatarsals and the calcaneus are parallel to the ground.
Mm-hmm.
It's just how they were born, right? That is a foot that structurally is planus, which means flat. What this means is that any amount of strengthening of the glutes, the intrinsics, the post tib, you're not ever going to get this arch in the foot like this, like a bridge, because how are you going to get the calcaneus to incline? Like that's part of what makes an arch in a foot is calcaneal inclination and metatarsal declination. You can't do that. There's no muscle that does that, right? So you won't change the morphology of that foot. Similar in certain types of cavus feet, it's not a mobilization problem per se. Those are structural. This is where you do fall in to reconstructive foot surgery, and there are certain elements, and that's where I guess I'm appreciative that I learned surgery, is because I can understand these extreme structural contributors to some of the pathology or the functional pathology that we see. But again, those are outliers. So we kind of digressed on the question.
No, that's all right.
That's where stereotypically I would say high arch foot stiff. We need to mobilize the plantar fascia, the intrinsics, the inverters, which means the post tib, the tibialis anterior, the soleus, right? We have to mobilize them so this foot can do exactly what I know you want it to do, which is internal rotation. I need some arch compression. I need that navicular to drop so that we can load. That's going to be most of them. There will be a few outliers that are clinical cavus feet. That is more bone. It's not a soft tissue flexibility.
Got it. Okay. So I'm glad you brought in surgical intervention at times because I see a lot of different procedures, or I won't say I see the procedure, I see the byproduct, the result of a whole slew of surgical procedures on the foot and ankle. And I have my own opinion on which ones might be effective and which ones were unnecessary. I'm curious about you, though. Is there one surgical procedure that you just shiver at and go, I really wish that we could change this? I don't believe that this is actually a necessary process. There's another way to do it.
So one that would be like a last resort would be fusion
Yeah.
of the first MPJ.
I thought you were going to go there. Right on. Yes. Okay. So the basically fusing the big toe, essentially the big toe joint, the MTPJ, metatarsal phalangeal joint, is what you're talking about. That first ray, for whatever reason, it's just not. It's not happy and it's not helping. So why don't we just minimize the movement by fusing it?
Right. So why this is frustrating, because there's joint implants. So there is another option. Now, typically when someone has a hallux limitus, which means they have,
Stiff big toe.
yeah, stiff big toe, they're probably sitting around like a 30 degree or less dorsiflexion, right? So they're starting to compensate when they move. And then you go through the different stages of hallux limitus till you have a hallux rigidus, which is essentially like no movement. On the early side of hallux limitus, you can do a surgery, which is a decompression, which means you're essentially opening up the joint to create more space so you can flex through the joint more. Okay. Now, if you wait too long and the arthritis progresses too far, well, now you're bone on bone, so you can't open up the joint because you don't want movement on raw bone. That's very painful. So you then either do a joint implant, a joint replacement, or you fuse it. You have two choices. Those are your two choices. Okay. So I push patients when I'm doing a second opinion on this to get the joint implant. Now, this is the side of surgery in podiatry, I'm sure in other specialties as well, where, and this sounds so fucked up, but excuse my language, where you're like, you know what? I kind of get paid like the reimbursement, or you're like, you know what? Doing a fusion is so quick, like you throw a plate on there. So the thought behind the surgeon is not what it should be. They're not taking a functional long-term, oh, this is a human who has to move after the surgery. They're just like, well, they'll be fine, like no pain, they're fine. The toe's almost fused anyway. If you fuse a toe, hands down, no way, 100%, you will compensate when you walk, unless if you're in like a hoka. There's no way that you can walk through a big toe that is fused and not be compensating. There's no way.
No, agreed.
Yeah.
Yeah.
So to me, why would you do that surgery?
Yeah. Beautiful. Okay. Uh, how about giving us an idea? And thank you for that. We could follow a whole bunch of rabbits down holes here, but let's switch to the webinar that's coming up. 8 weeks. We'll all be together this week, and then Bill will have 2 weeks of webinars, followed by yourself for 2 weeks, and then you give me the cleanup at the end, and then we all gather together for week 8. But for week 4 and 5, that would be you. What are you going to be talking on? What's your part of the webinar?
Yeah, so I'm definitely going to be speaking about part of what we're speaking about now, which is some of these differences in foot types, making sure that everyone's kind of on the same page. We're all speaking the same language when it comes to foot mechanics, foot types, foundations, and then how does that foundation connect into the rest of the body? Of course, this is fascial based. So I am a huge fan of the connection of the foot into the rest of the body, specifically your center of gravity into the pelvic floor, into the diaphragm, all the way up to the tongue. And I'm also very intrigued by how your fascia relates to the ground, meaning ground reaction forces, and how your body is potentiated through the energy from the ground and how you utilize that. You could consider that movement efficiency component of it, and just really tying in a from the ground up approach to stability and movement efficiency.
Right on. And this is going to be broken up into 2 weeks. And for the listening audience, it's going to be live noon on the East Coast and 9 a.m. on the West Coast every Wednesday for the next 8 weeks. What else do you have coming up? Because you're always out there with your educational products and platforms, and you're always teaching. I know your calendar is full, but a few kind of landmark events coming up this year?
Well, yeah. So one of the biggest things is that Naboso just acquired my education company. And so this is big in the sense of my vision for Naboso. And if the listeners don't know Naboso, I brought it up briefly, but it's a sensory-based product line that I founded, that we just entered our 6th year, I believe it is, 5 or 6 years. And to me, it's about changing behavior. So trying to impact people's lifestyle by having them prioritize foot health. That's essentially my goal. Yes, I sell physical products. Yes, I see patients. And then, yes, I create education. But all of them is really to educate, to empower people to prioritize their foot health and to understand that foot health, really, we're not talking about feet. And you're not either in everything that you do. And what we're doing with Bill in a couple weeks is it's not about feet, it's not about fascia, it's really about movement. That's what we're talking
Right.
about, right? It's a movement story, and movement is critical to living a high quality, long life, right? Like if you think of whatever you want, you were just telling me that you were surfing. Surfing is a movement. You have to understand your body, your feet, your center of mass, where you are, your visual, like all of this story. And what we love to do, I love to do Latin ballroom. That's my thing now, is I do competitive ballroom dancing. That's a movement. Do people want to walk their dog? Do they want to play with their kids? Whatever it is, right? So the more that we fit feet and foot health into that story, that's then a lifestyle change that I'm trying to do. So with this acquiring or acquisition of EBFA, essentially Naboso is now a content forward education based company that happens to sell physical products, but we are using the education to empower consumers to really understand their body. That's that's really a huge focus. Um, so when you ask me what I'm doing, is essentially formulating.
No, I'm glad you delineate that too, because I mean, obviously, at the end of the day, you want to sell items, but the center of it all is education.
Yes.
And honestly, I mean, I tell people to fold up a sock if they don't have a wedge nearby, just anything. Get a little book and open it up, and we just need something under there to create an experience that you haven't had, right? But if you want to, yeah, these are here, but I really need you to understand the why behind what you're doing. So, and that's what you're doing too. Okay. How about this? A little fun action. I've been really having a fun time with rapid fire questions with my
Yeah.
guests. So I've got some, and it can be one word, it can be a sentence, it can be a paragraph, or you can run with it, whatever you'd like. But we'll try and make them quick. You up for it?
Yeah.
Okay. We'll start off with the easy ones. Barefoot or minimal shoes if you had to pick one forever.
Barefoot.
One foot cue that instantly improves your posture.
Push your toes down to the ground.
A most common foot myth you wish would just disappear.
That you can reverse bunions without surgery.
The best place to go barefoot that most people never think of.
On a Naboso mat.
I love that mat, by the way. How about this? Toe spacers, fashion statement or function key?
Function.
If your feet could talk, what would they complain about first?
Mine?
Well, anybody's. How about anybody's? Not yours. You're probably just, hey, we need to get back on the dance floor is probably what they're saying. We don't get enough of that. But the average person.
Release me.
Nice. Naboso texture under your pillow, yes or no? Hey, I just didn't know. I'm not sure. Most surprising body part that foot strength influences.
Your tongue.
Sweet. One thing everyone should do every morning, foot wise.
Release your feet on a narrow ball.
Excellent. And the favorite way to mess with people's balance, but in a good way.
So I like to do vestibular, where you shake your head like this or like this, like you're a cup of water and you're trying to shake it.
That's awesome. I like doing eye circles. So
Mm,
waking up the visual field. Uh,
cool.
very cool. Oh, that was good. And that was actually probably the fastest rapid fire I think I've had so far. Awesome. Okay. So just for listening audience, once again, you can go to Bill Parisi Speed School. Check its Instagram, social media. You'll find there's been a whole bunch of posts out there between the three of us. If you want to sign up for the webinar, please do. I think it's going to be a great time. And if people want to learn more about yourself, Doc, where should they go? What should they do?
Yeah, so my Instagram is dremilydpm. So that's my Instagram handle. Naboso's Instagram is Naboso_technology, which you mentioned my name is Czech. Naboso is a Czech word also. That means barefoot.
I thought it was Japanese. I really did all this time. Are you serious?
Yep. Yep.
Wait, it means barefoot?
Yeah.
Oh my gosh, I love this. I just learned something that blew me away.
Sorry. So it is also a Korean word, but you have to say it different. You have to say Naboso means look at me in Korean.
Wow, there's a double entendre right there. I like that.
Yes.
International.
Yeah,
Wow.
I know. Yep. So Czech, Korean. And then, sorry, real quick, my website is my name. So my name is on the screen, but DrEmilySplichal.com. That's if people want to see me as a virtual patient. I do see patients in person in Arizona, but most of my patients are virtual. And yes, I can treat almost everything virtually. I've mastered the telemedicine way before COVID. And then Naboso is naboso.com is our website.
Okay, and I guess the final question would be, what is the most memorable way somebody has butchered your last name?
So, before I got into the whole barefoot thing, I had a workout that was called Catwalk Confidence. It was a high heel workout. But
Nice.
and this is when I was living in New York City, and this was still the Sex and the City days. This is before athleisure. And so I was on a lot of TV shows, and I went on the Today Show, and they butchered my name on national TV.
Oh, that's even better.
Fine. And I think that they were like, "You're not a doctor. You're too young." And then they butchered my last name. I think it was something like that. Was Kathy Lee Gifford did that.
Well, at least one of you are still standing, so that's a good thing. This has been so much fun. I'm looking forward to the webinar too. This is going to be a great place to learn more, and I've already learned quite a bit in this time. So thanks for coming on. I really appreciate you.
Of course, so much fun.
Okay, I don't know about anybody out there that really gets into the feet like I do, but if you do, then that was a pretty darn good conversation. If you want more information about Dr. Emily and all the stuff she has, check the description below the podcast. Plus, you can also get information about the 8-week webinar that's coming up, Fascia, Feet, and Functional Performance. Bill Parisi, Dr. Emily Splichal, and myself kick it off this Wednesday. There's still room, so sign up now, and let's just listen to our sponsors one more time. Have yourself a great weekend, a great week, whatever it is. We'll see you next time. Remember to check out metabolicelite.co. Check out all the products they have on their website. Synapsin Pro is something I've been using to help stay focused without having to over-caffeinate myself. It keeps me in the zone so I can just really hone in on the things I need to achieve without feeling like, man, I gotta reach for an energy drink every 5 minutes. Metabolicelite.co. And don't forget, Kinetic IQ. They've got markerless motion capture for morons like me. I can use their product with my iPhone or my iPad. I can look at posture analysis, movement analysis of any exercise, gait analysis. It gives me everything I could possibly want when tracking people's movements. So, check out kinetikiq.com.